లైక్ చేసేసాను అమ్మా లేట్ అవుతుంది.
Recording in progress.
హాయ్ అండి, దిస్ is డాక్టర్ పి రవికిరణ్, జనరల్ ఫిజిషియన్ అండ్ డయాబెటాలజిస్ట్ at Onos Robotics Hospital, Champapet. As a part of webinars where we are trying to educate the society about the ill effects of diseases and the lifestyle disorders, today let's discuss about diabetes. What is diabetes and what are the types of diabetes? Generally, people know about only two types of diabetes, type 1 and type 2. Type 2 being the most common type of diabetes, it's followed by type 1. But apart from the type 2 and type 1 diabetes, there are two other forms of diabetes known as LADA and MODY. What is LADA? Latent onset adult diabetes disorders, which is of autoimmune origin. Latent onset autoimmune diabetes of adults, whereas MODY is maturity onset diabetes in young. These are the four types of diabetes, which are the most common forms. Apart from these four types, there are a few other minor types like gestational diabetes, steroids-induced diabetes, etc., etc. But we are trying to discuss about the four topics today. Why this webinar? Diabetes is not one disease; it's a group of metabolic disorders. Many patients are misclassified or wrongly treated for years, especially MODY diabetes, monogenic diabetes, are misdiagnosed as type 2 diabetes and treated as the same. Sometimes MODY's diabetes is considered as type 1 or LADA and are put unnecessarily on insulin, which can be avoided if we properly diagnose the patients and give them a better life. Because taking a pill a day is far better and far easier than taking an insulin injection, which could be painful lifetime. So proper diagnosis can help us there. Early correct diagnosis improves long-term outcomes. Today's session will simplify everything. What is diabetes? Diabetes is a chronic metabolic condition where the body cannot regulate blood glucose properly due to the lack of insulin, insulin resistance, or both. Lack of insulin can be secondary to multiple causes, where the beta pancreas cells are not present in the body to produce insulin, or the insulin produced by them is of not proper quality, or the body is not responding in view of insulin resistance. When we consider diabetes is when the fasting blood sugars are more than 126 milligram per deciliter, or HbA1c is more than 6.5, and the post-meal sugars are more than 200. The role of insulin. Insulin is one hormone which is produced from the pancreas and it acts on three major organs, the fat cells, the liver, and muscle. Muscle is one of the major organ which gets affected by insulin because insulin is responsible for absorbing 80% of the blood sugars into the muscle to maintain our homeostatic status. Whereas liver and fat cells, they have the function of storing the excess energies that are consumed by the body with the help of insulin. Insulin helps the body store the excess amount of sugars consumed through the fat and liver cells. Insulin helps glucose enter cells. Without proper insulin action, blood glucose stays high. Over time, as the blood sugars are high, heart damage, eye damage, and nerves damage, etc. happen. Types of diabetes overview. Let's see here. There are multiple types: type 1 diabetes, type 2 diabetes, gestational diabetes, steroid-induced diabetes, LADA, latent autoimmune diabetes in adults, and MODY, maturity onset diabetes of the age. And there is also one form of neonatal diabetes, which is a rare form. Of all these, type 1, type 2, LADA, and MODY are the common forms, which we will discuss today. Type 1 diabetes. It's an autoimmune condition where the own body destroys its own beta cells. Autoimmune condition means where our own immune system identifies the beta cells of pancreas as foreign particles and attacks them. In this process, the entire beta cells are destroyed and there is no insulin produced in the body. Key features, especially occurs in young adults and children less than 20 years of, approximately around 14 to 15 years of, which is a time where the type 1 diabetes occurs, somewhere 9 years, 10 years. Sudden onset. The most common presentation is the children presenting to the ICU in shortness of breath, where in view of ketosis and acidosis, they go into acidosis, they're not able to respond. Requires lifelong insulin treatment. Genetic predisposition plus environment triggers are one of the most common cause for diabetes. And speaking now, there is no definitive cure for diabetes. Many of the treatments are under pipeline, but the only cure present now is insulin. To investigations, how can you confirm that the patient is having type 1 diabetes? C-peptide hormone. This is one of the major hormones which plays a key role in differentiating the different types of diabetes. C-peptide, where the insulin is low or absent. Autoantibodies against the insulin and the pancreas, the GAD antibodies, IA2 antibodies, ZNT8 antibodies, these are positive in blood tests. So these two investigations help us lead towards type 1 diabetes. Treatment is basal bolus insulin. The insulin is the only form of treatment as of now for type 1 diabetes. In type 1 diabetes, there is no insulin production. So we give insulin per type 1 diabetes. Counting calories and continuous glucose monitoring are the accessory things which help us control the sugars properly. But insulin is the most important thing. Type 2 diabetes definition. Type 2 diabetes is the most common diabetes. More than 90 to 95% of population have type 2 diabetes. It's a metabolic disorder with insulin resistance and slowly gradual beta cell dysfunction. First, insulin resistance leads to hyperinsulinemia, where pancreas overwork to produce more insulin to cover the insulin resistance, which gradually leads to beta cell failure, and it can present with no insulin production in the later stages of life. Most common, linked with lifestyle, genetics, obesity, and inactivity. Slow onset, often undiagnosed for years. A person who presents to us with type 2 diabetes today has his body changes occurring for the past 10 years and present till now. Strong family history. Investigations. C-peptide helps us to differentiate because in type 2 diabetes, C-peptide is normal or high in early stages, secondary to hyperinsulinemia. As insulin is more, C-peptide increases more. So early stages, it may be high. No autoimmune antibodies. Insulin levels are high initially. Treatment, the most common treatment is diet and lifestyle modification. Only then comes the role of medications. Insulin is used only in advanced stages where there is beta cell dysfunction and beta cell failure, where there is no insulin produced. In type 2 diabetes, insulin is produced, but the cells do not accept the functions of insulin and don't respond to insulin. That is type 2 diabetes. This can be changed with the diet and lifestyle modifications, which would be helpful in diabetes treatment. Type 1.5 diabetes. This is the LADA is also called as type 1.5 diabetes because it's in between type 1 and type 2. When I mean it's between in type 1 and type 2, it means that it has the features combined of both type 1 diabetes and type 2 diabetes. It is an autoimmune diabetes which starts in the adulthood. We have already discussed type 1 diabetes, which starts in younger group, less than 15 years, less than 20 years. But LADA starts in a later stage, which age more than 30 years is the most common presentation. The patients are non-obese, not like type 2 diabetes. And because it's a slowly, gradually occurring thing, initially the patient responds to oral medications, but as the disease progresses and there is complete destruction of pancreas, beta cells, then there is a complete requirement for insulin. These patients may also be GAD antibody positive. GAD antibody positive. Why important? The thing is, why is it important for us to diagnose LADA? Because wrong treatment delays insulin and which will cause faster beta cell destruction. Because beta cells are overfunctioning in view of reduced beta cells, the overfunction of beta cells will get destroyed faster. Investigations, GAD antibodies, C-peptide. C-peptide in the follow-through, the C-peptide will be coming down lower. Initially, in the early stages of the disease, C-peptides will be high, but as the disease progresses, the C-peptides level starts coming down. Treatment, start insulin early, avoid sulfonylureas. Because in LADA, sulfonylureas are beta toxic and they kill beta cells. Because so if you use sulfonylureas in type 1.5 diabetes, the disease progresses faster and the patients becomes dependable on insulin. Maturity onset diabetes of the MODY. It's also called as monogenic diabetes because it occurs secondary to a single gene disorder which is inherited in the families. Definition is a group of single gene monogenic diabetes disorder. Age of onset is less than 25 years. So there are high chances a MODY patient can be misdiagnosed as a rarer cause of type 1 diabetes or type 2 diabetes. If the patient is thin and young, this MODY can be confused with type 1 diabetes, whereas the patient is over on the heavier side, then he may be confused to has type 2 diabetes. So But how do we differentiate MODY from type 1 and type 2? The most important thing is strong family history. There are at least 2 to 3 generations of family history where there would be young onset diabetic patients who would be suffering from the disease. And majority of the times they are not obese, not insulin resistant, and not autoimmune markers. Where the GAD positive or GAD antibodies, ZNT8 antibodies, and insulin antibodies are not present, and no insulin resistance markers like acanthosis nigricans, all the skin blackening, face blackening, overweight, these symptoms are not present in these conditions. Types. There are multiple types. There are nearly 6 to 7 types of MODY, but of them, the most common types are MODY 3, MODY 2, and MODY 1. These patients respond extremely well to medications. The MODY 2 GCK mutation, that's milder or milder form, there is no treatment needed. There are some types of diabetic patients who need no treatment. Of them, MODY 2 is the most common form. So there is no treatment for MODY 2. Whereas in MODY 3, they respond well to sulfonylureas. See the irony. In LADA patients, sulfonylureas are contraindicated, whereas in MODY, these drugs are the first line drugs. So low dose sulfonylureas work extremely well in MODY 3, which is the most common type of MODY. Whereas in MODY 1, it needs tablets or insulin in the later parts of life when there is beta cell dysfunction. Genetic investigations. How do we differentiate MODY from type 2 and type 1? There are genetic panels which are available in outpatient basis where we can get HF, HNF1A, HNF4A, and GCK levels. The genes where Sanger sequencing and etc. techniques can be used to identify the genes, and the patient can be labeled as a MODY 3, where the treatment would be a bit different. Comparison table. Type 1, type 2, LADA, and MODY. Type 1 and LADA are autoimmune conditions, whereas type 2 is insulin resistance. MODY is a genetically mutation which would present with diabetes. Age, type 1 diabetes occurs in young patients, whereas type 2 occurs in more than 40 years generally, but now it's coming younger. LADA more than 30 and MODY less than 25. Body type, see the differences. Body type, type 1 patients are lean, LADA patients are lean or normal, and MODY patients are lean or normal. C-peptide levels, very low, very low. Type 1 and LADA present very similarly, but the intensity is different. C-peptide is very low, C-peptide is low. Here the C-peptide is normal or high, and here it is normal. Antibodies are present in type 1 and LADA, whereas negative in type 2 and MODY. Treatment, insulin, early insulin, tablets with insulin, and gene specific. If it is MODY type 2, there is no treatment. If it is MODY 3, sulfonylureas is MODY, like that. Why correct diagnosis matters? Because a patient who has MODY 2, there is no complications for him in his lifetime. So there is no need for us to push him on medications and provide him new complications. Whereas in MODY type 3, only sulfonylureas work best. Whereas in type 2 diabetes, diet and lifestyle changes and other medications are the first line, whereas sulfonylureas take a backseat in type 2 diabetes. In type 1 diabetes, there is complete need for insulin. In LADA, there is complete need for insulin. Because if we don't know the root cause, then we won't be able to treat it properly. The complications would be higher. Investigations you should know. The HbA1c, fasting and postprandial, C-peptide, GAD and IA2 antibodies, lipid profile, kidney function, genetic testing for MODY and other urinary complications, urine tests to assess early complications. My clinical approach. At Onus Robotics Hospital, we follow early classification, root cause based treatment, nutrition, activity, and lifestyle modification, personalized medications, and regular monitoring. Like in regular monitoring, we would be using continuous glucose monitoring where needed and follow up the patient on a daily basis to see what's going on. Myths versus facts. Myth is all diabetes are the same. The fact is there are multiple types of diabetes which need very different treatments and with different prognosis. Young people can't get diabetes, whereas MODY and type 1 diabetes are common in the young. With starting insulin means failure. This is one of the major things. But remember, in type 1 and LADA, insulin is life-saving, and these can only protect the patients. Summary. Diabetes is not one condition. Type 1 diabetes is the condition where there is no insulin. Type 2, there is resistance plus decline. In latent autoimmune diabetes of adults, there is adult autoimmune condition, slowly progressive condition. MODY, maturity onset diabetes of young, it's a genetic cause. So the correct classification saves lives and make the person's life better. Thank you. If you want a personalized evaluation for your diabetes or you're unsure about your classification, you can consult us at Onus Robotics Hospital at Champapet. Follow for daily diabetes education. Thank you.